And welcome back. I'm your host, Michael Staventinos with the Advancing Healthcare Innovation Show. And if you're new to us, man, we're super excited to have you here because we're having exciting conversations with real leaders that are painstakingly shaping the future of healthcare. And we're just very, very passionate about healthcare, innovation, adoption, access, and leadership. And if it's your first time tuning in, we're happy to have you here. Let me just tell you a little bit about what we do. So we are a healthcare consortium. We're focused on innovation and bringing stories of innovation within health to life. And the aim is highlighting real people that are actually doing things within our space and giving them the platform to share their stories with the world. And we've got an incredibly action-packed year with an amazing new content, great interviews coming up. But if you haven't checked out any of the historical interviews, pause, go back, check out, and hit the subscribe button now so you get any of the new content coming right over to you. So I'm thrilled today to welcome our special guest, an individual who's reshaping, in my mind, the future of digital health and molding kind of the healthcare landscape with his intellect and innovation. It's Rob Blatt. And Rob goes far beyond just being the typical healthcare enthusiast. He's an entrepreneur, an innovator, a thought leader, and just much, much, much more. But most notably, he's serving currently as the CEO and co-founder of envoyatHome, a digital health software company that's really becoming a game changer in the industry, building upon their initial premise, which is approximately 40% of health outcomes are behavior driven. And Rob has led the envoyatHome to some pretty unique heights, actually. And the company's mission, it's actually capturing, understanding, and driving those behaviors that lead to optimal health outcomes, with a particular emphasis on aiding seniors in safely aging at home by utilizing this breakthrough patented technology and algorithms. And Rob's achievements, they don't just stop at envoyatHome. He's also an ambassador for the Philadelphia chapter of Aging 2.0, further underscoring his commitment to enriching the lives and innovating within our space. So Rob, just amazing to have you here, and welcome to the show.
Well, thank you. I'm honored to be here, and I really am glad to have the platform to share this with you.
Yeah,
and your viewers.
Yeah, so let's talk about, well, our community is just a really, really special community, and we're all about getting connected with other doers that are in our space. Let's talk a little bit about your story. Your story is really interesting in terms of your background. You know, how does a finance guy, a financier early on, kind of delve into this particular problem that you have just been razor sharp focused in on? Can you give us a little bit more context into sort of that transition?
Yeah, actually, let's go back a little bit further. Before I was a financier, as you would put it, I actually come from a background in technology. I have a master's degree in computer engineering, and so my real roots are in this idea of real-time data and technology. So I live in this world of real-time data and finance where numbers matter, decisions matter. After I left the technology world, I was working for a buy-side asset management company, leading their technology infrastructure, if you will. And so my background is in the space of data and technology. So a couple of years ago, I lost a family member, or my dad actually. So my story is one of those stories where it's personally connected. It's one of those stories where necessity becomes the mother of all of invention. And I found myself a remote caregiver. Family is down in Florida, South Florida. I'm up here in the Northeast, roughly 1,200 miles away. And so how do you be a caregiver to a loved one who is in desperate need of knee surgery, who's living in a home much too big for her needs, and is on a limited budget? And after looking around, looking for solutions, and discovered there really aren't any, it led me to think about, well, why, I can't be the only one who would have this need. And so we started building out envoyatHome. We thought about how we would solve the problem. And it came from this space of understanding, how do you know that something didn't occur, right? So if you think about an ordinary alarm system, if you will, it's about unexpected activity. And so we started thinking about unexpected inactivity. And then that led to our innovation, our patent, our whole space around behavior discovery and behavior monitoring. And then we grew from there.
So, this kind of lends itself well into aging at home. And do you find now where does your solution kind of fit within that landscape? Because there's a lot of remote patient monitoring companies. There's physicians that are making visits at home. So there's this push around innovation towards home, home. Where do you see Envoy at Home fitting into that landscape?
Yeah, that's a great question. So let's sort of divide the world up into a couple of different categories. The word remote patient monitoring, that typically is when people talk about that, they're typically talking about glucose monitoring or getting on the scale or any sort of physiological monitoring, those kinds of things. What we're talking about is this idea of behavior monitoring, and I'll tell you why that's important in a minute. And we also have a solution that's completely passive. So there are no wearables, there are no recording devices, there's nothing to charge. We are about as invisible as you can be. And as it turns out, Michael, that's really a good thing for a variety of reasons. And so in the space of helping families keep their loved ones living longer independently, the very first question people have is, what is mom doing? Are there risky behaviors going on that can compromise her safety and wellness? We don't know what we don't know. And as it turns out, when you think about keeping a loved one home, the very first sign you think mom or dad may need some help in the home, most people think about potentially bringing in a home health aide, a body into the home. Well, in the last few years, as I'm sure many of the folks in your community will know, that has become a prohibitively expensive endeavor, and it's very hard to find people. You can easily spend $1,500, $2,000 a month, and multiply that by 12, which really puts it out of reach for most people. The other thing people think about is, well, maybe I should get mom a pendant, a button to push. And we know that that solution isn't for everybody. It has limited efficacy. And we live in a world, Michael, where we figured out how to keep people physically healthier, but what about our cognitive health? What about the people who are experiencing cognitive decline, where we really don't have any good solutions around prevention, around monitoring, around diagnosis, and so forth? And so we have this world now where we can physically keep people alive and at home, but now we have our body is failing cognitively, and we have this other need. And so we have this tsunami of aging adults who are experiencing cognitive decline, and there really aren't solutions for that segment. And so what our customers have found is that we're a fantastic solution to help care for their loved one and allow them to live independently longer.
It's interesting that you talk about this. I mean, in a roundabout way, you're talking about access, and you're right. Hiring a private caregiver sometimes isn't affordable, and I know in many cases that it's not an option. Maybe insurance doesn't cover that. I think in certain instances, depending on certain states, Medicaid covers some number of hours. But what's happening in between those hours that a caregiver is not there. So talk about maybe how intervention happens, how you measure that, but then how actually action happens. Like, I know you're amassing lots and lots of data, but what good is the data in terms of when action doesn't occur? Talk about maybe a use case, talk about maybe a story that you can share of how this actually works in action, because I think that might be able to kind of crystallize a little bit more for the audience.
Yeah, happy to do that. And let's just expand. You mentioned the word access, And
Yeah.
there is affordability. We're about 100th the cost of traditional care. And then there's this idea of agency, putting families back in control, caregivers back in control. And many people tell us that they've lost their sense of agency because they really have no um, they have no alternative, and now we can provide them different alternatives. And to the affordability point, what we've also learned is that 86% of families can't afford enough care, and they never will. So this is an enormous problem, right? And so let's dive into a use case. And here's how one family is using envoyatHome. And so let's also make it clear how the solution works a bit, so people can really relate to this. We use these commercially available sensors that are placed around the home. We do that with people. It takes about an hour. They're about the size of each sensor is about the size of a pack of cards, playing
Mhm.
cards, and you're up and running very quickly. But the use case is really interesting. And so what we found is um, we have a family caregiver now who's working with their primary care physician on behalf of their mother. Their mother is diagnosed with dementia, and they're adjusting medication now to help her have a more restful night's sleep. And what we've helped the family discover is what is mom doing at night? And what they've discovered is that she's wandering around, and some of it is purposeful wandering. So,
Mm.
for example, she's getting up to go to the kitchen. Why? She's probably hungry. She's getting up for bathroom reasons. Why? Because there's probably a need there. And then she's also wandering around to other parts of the home. And so now that they have this data, they're looking at the impact of both medication on her movements at night. They're also looking at her nutritional timing, so that perhaps if she has a bigger meal, so this is not an expensive intervention, later in the evening, can we help her get a more restful night's sleep, which would make her more functional during the day?
Mm.
And by the way, when you're moving around at night, walking through your home, where there may be stairs or long hallways and whatnot, and it's dark, you're at a higher risk for bad outcomes.
Something happening.
Um, so that's just one example where families are using our service. We've also had families almost every time we start up a new client, Michael. There's usually this: I had no idea that mom did whatever, and in some cases, it can be so alarming and it's so troubling. They've had to take the data, bring it right to their primary care physician for immediate interventions.
I mean, this might be a foolish question, but when you're talking about folks that have some cognitive things that are going on, are there instances where they leave the home? And then what
Yes.
happens then? Is
Yeah.
there notification? Is there
Yeah.
some sort of alert
Yeah.
that notifies family members?
Yeah. So yeah, that there is we certainly do that as well. What we tend to see is that usually people who are living at home just don't wake up one day and open the door and leave. There's usually a progression to that state, and that progression typically starts around wandering around the home at night. That's sort of step one. Step two, there may be some anxiety demonstrated around opening and closing the door a lot. And then step three might be they actually leave the home, that elopement risk. And so what we're able to do is spot all of those stages. We provide both real-time notifications, which typically is what our family caregivers appreciate, but
Mhm.
it's this idea of all of this data and how do we use it in an actionable way that our care teams and I think our clinicians really appreciate. So we have this spectrum of need, and we have this capability that's both real time as well as data over time to be able to create the most impactful interventions for the individual. So it's really bringing in a personalized,
Yeah.
care plan to somebody.
And listen, this is something that is not easily done at scale. Would have been some of the things that I guess have prohibited masses or what have been some blockers? Because you know that there's naysayers that are out there. What are some of those things that you've had to overcome, that you'd have to come through? Can you give us a little bit of a tidbit around that?
Yeah, the single biggest challenge we have is the status quo.
Good
It's
enough.
really that simple. Um, we're much easier to set up than a Ring doorbell. We're much easier to set up than a Nest thermostat. There are no wires involved. Most people today know how to set up their own internet modem. And I have to tell you, if you've ever set one up, it can be quite a task getting it provisioned. We're literally a plug in the wall, and everything else is wireless. And if you can hang up a Christmas decoration with a little adhesive, we're no harder than that. Now, on the technology side, on the back end side, we happen to be sitting on the world's largest smart home platform. So that's not an issue for us. We're like that killer app. Once you attach our app to access the real-time data, which happens in minutes, it's really very easy to scale this. And so when it comes back to what are the obstacles, it's only the status quo. Most people and most professionals in the industry don't realize that a solution like ours is easily available, easily accessible, incredibly affordable, and can be up and running in under an hour.
So when do they then, so for example, like home care agencies, initially was the perception that they viewed you as a potential competitor? And
Some
now
did.
do they now view you differently, in the sense that maybe you can be complementary, where someone maybe wasn't necessarily a fit early on for them, they could essentially say, hey, maybe there's a lower level of care. Maybe you don't need to have someone that's in your home 24/7. Maybe this is another option. Are there ways that you've been able to sort of, I'll just call, loosely partner with other clinical or personal home care providers that can really help get this out there even more than what it has been?
Yeah. And so if you again look at the landscape of home health providers, you see a lot of different kinds of practitioners. You see those who are really just very human centric based, and you have those who are more open and willing to adopt technology where they recognize the benefits, where they can see how it can help them expand care, lower cost, and just bring more value to the clients that they serve. And so with that population in mind, we have found partners who are looking to bring dementia related services to their where it's incorporating envoyatHome into a solution for a family. Or we're working with partners who recognize we're a really good solution to help them understand what's happening at night, because most people can't afford to turn on that overnight care because of the expense involved. And quite frankly, there's a lot of you really have to be comfortable bringing someone into your home 24 hours a day, and a lot of people, they're not ready for that. So we help people, we help home care agencies where they're working with their clients, where they can help families start care, start services, understand the need, and then grow from there. And
Mm.
then there's just there's that spectrum in between, and you have different providers who really understand the value proposition, and they're able to grow their line of service with new offerings and stay competitive. And then, of course, you have some of those operators in that business that are a little bit slower, and that happens everywhere.
Mm. Has it been mostly driven directly to the consumer? Because I mean, I remember you and I were talking a little while ago, and you mentioned that there's people that are just finding you. Where do you see that that level of connectivity happening? Is it really just such a pervasive issue that people are just really just trying to research and find anything? What
It
has it been?
is. It is. People are hungry for solutions. I think one of the silver linings, if you will, out of COVID was that there has been a change in consumer preferences and a willingness to accept this idea of remote and technology-based solutions. Clearly a solution like envoyatHome has benefited from that. And so consumers are finding us in all parts of the country who are either, in some cases, they may live across the street or in the same neighborhood, and in some cases, they live different states. But everyone has the same need. They've recently seen mom. They were surprised at some of her or his cognitive decline, and they're worried, and they want to be able to put a solution in to help them live independently as long as possible. And it's a theme that we hear over and over and over again.
Yeah, I mean, what's interesting, just even for me, as my parents start to get older, a recent trip back to New York, you start to see things, you start to hear things, and you're like, wait a second, like they're getting old. And it's just really bizarre to say that, because you think of your parent, at least for me, I think of my parents in a certain light. Um, what what do you think is sort of the next frontier outside of this when you think about the future? And if you look in your kind of crystal ball, why do you think things are shifting so quickly the way that they are shifting in terms of adoption of something like this?
Yeah,
What
and
are some
and
of those factors?
we look at that crystal ball a lot, probably more than you might think we do. But if you look out, I mean, look at the landscape. We're essentially an aging nation. We
Yep.
are out of caregivers, and your community knows this. So the things that I'm saying here are not going to
Yeah.
be new. And the cost of care has skyrocketed. It's unclear whether a fee-for-service based system, as we're in, can continue to exist in the foreseeable future. Things like Medicare will have to radically change to more of a value-based care service. So when we look at those kinds of when we look at that future, the only way to address care is through technology. Now, you said something interesting in your intro, or my intro, I suppose, about behavior, and it's
Yes.
40%. Let's put that in context. Behavior, not just is at 40%, it is the single largest determinant of health. Medicine is only 10%, right? Our
Yeah.
genes, I believe, are 20%, and our social status is social factors are 30%. So the single largest determinant of health is behavior. And so far, it has been completely untapped. And where do people spend most of their time?
Oh.
In the home. And so what we're able to do is bring this behavior data set that's generated from living in your home into this space of care. And that's where we see the future. And if you look at the sort of the trajectory of where we were and where we're going, it was, well, when you need care, you bring in a body. Human centric, you bring in a body. And then after that, it was more of about a siloed approach. We need an RPM tool, right? We need to be able to measure something in the home. But now we're in this space where we're passive, where we can be integrated. We can take on we can take on other. We can incorporate other data sets into our platform. And so when we look at the future is now, how do we really make the most use out of that data through interventions, improving the quality of care, and creating a pathway to much less friction. And we see that, and we're working on it now. And we see that, and I'm going to use this term AI. I know everybody is using it, and let's not get scared over it. Let's be comfortable with it. But imagine, you talked about your parents. Imagine if your parents had a proprietary data set. It was a data that they generated, and we used AI to look at that data. And so you can ask some questions about, what's happening at night. Are there anything I should be concerned about? If mom or dad has had a change in health status, or they are recently discharged, or if you said, mom recently was discharged 3 weeks ago, has anything changed at night? Can you imagine the power of that? And that's what we're building today.
You think about the amount of data that you capture passively, 'cause it's not like you're asking them to do anything.
Nothing.
I think that's the key. The key is to not ask them to do anything.
Nothing.
That's
There's
the, that's
not even an off switch. There's no panels, there's no tablets, there's nothing. We just ask, just live your life. You live your everyday life. That's it.
you mentioned something about value-based care, and I couldn't help but sort of ponder and swim further upstream to think about payers and how they're managing some of their populations. Where have you begun to really entertain some of those discussions with the payers, payviders, folks that are caring for larger populations, particularly ones that might even be more dual eligible? Can you maybe share some thoughts around that?
Yeah, we know that there's a lot of interest, based on the whole landscape. We're having conversations with some of those payviders and providers as well. And to be frank, I'm hoping through perhaps this forum that we're working today, we can get the message out. We're looking to actively expand relationships and partnerships. We believe this is a fertile landscape to really not just drive down the cost. I mean, because that just sounds so self-serving, but we have to recognize how important it is and how expensive things have become, but also to improve the outcomes. I mean, you're sort of back to those triple aims of healthcare. I mean, how can we move the needle on large populations? How can we provide a better experience for patients, right? And that's really what we believe, that using this behavior data set combined with some AI can really move the dial.
Yeah, I mean, so how are you talking about taking this data, publishing research? Like, how do you want to use this data? Because clearly you've amassed a lot of it over the course of the last several years. What does that look like? How do
Yeah,
you how do you kind of tell that story?
yeah, I think if we had this conversation in about next quarter, I might have a better answer for you, because we're actually
Okay.
working through some of the ethical issues now. We're working through some of the other thorny issues around how do we, how can we both mine the data for good, preserve privacy, all of those
Yeah.
kinds of things. So we actually are working through that now. We have on our team some clinicians, some professors from the University of Pennsylvania, some others, and there is a lot of different views on how to, around this topic. And so we haven't made any decisions, but we do anticipate that, of course, whatever we would do would require, consent, and, would both meet not just, of course, the legal threshold, but ethical thresholds as well.
Well, I guess that's all the more reason to come back onto the show and on part two, where you'll be able to share some of that. How can folks continue to follow you, follow your work? Give a little bit of a plug on where people can kind of continue to follow your story, follow your journey.
Yeah, great. Thank you. You can always find me on either LinkedIn. You just look up Rob Blatt. You can certainly email me at rob@envoyatHome, envoyatHome.com. And you can come to our website, leave us a little message, and we will follow up with you. We have a great process in place, when we are actively seeking partners. So if you're in that community and you're watching this and you'd like to learn more, where you think there may be some synergy where we can help, please reach out.
So we do like to, as we're a community of doers, I like to kind of ask this question in terms of, all right, you have the ask, which is, hey, look, if anyone wants to kind of partner, great. But if there is one action item of anyone that's listening here that they can take action on, what is that one thing that they can take action on from this discussion?
I think that the one action item is really to reach out, because what we can really help, we are helping people today, is really the fundamental, is really the bottom line. And we can bring this to larger populations, it really will serve all of us well. And our mission is really to help people live independently longer. And along that journey, I think we're going to unlock a lot of opportunity. And so for those folks who are in your community, who share similar missions, I think that there's really exciting opportunities for partnership, and we would love to have the opportunity to talk to those people.
Amazing. It's nice, Rob, when values align. I think that makes it all the better. And for those that have tuned in today, just want to say thank you. Really appreciate it. If you found the content helpful for you, would you mind even just sharing it on social media, tagging another fellow professional and just adding them onto it with your network? I'm grateful for all those types of activities. It does make a difference. We want to move health forward. And it's nice when you bring a community of doers and innovators together. So Rob, I'm looking forward to having you come on sometime again in the future. And in the meantime, look forward to our next conversation.
Right. Thank you, Michael.
You bet.